ASCP has been moving, and I think you heard last year, as the slide scrolls a bit, about some of the central concepts and themes that our task force of transition has identified as critical to the future of pathology and laboratory medicine. And the concept that we talk about, this concept of patient-centric advocacy, of centering everything we do in laboratory medicine and pathology on the good of the patient, is critical to our vision of how pathology and laboratory medicine will survive in the coming years. And as you can see in this slide, we play with the letters. Patient-centered advocacy is the reverse of ASCP. Advancing pathology, advancing society by caring for patients is sort of a mnemonic for what ASCP stands for. And what I want to do in the next 15 minutes or so, maybe a little more, is look at this concept of advancing, caring, playing off those words, and I'm going to put it to you in the audience to evaluate, although there won't be an audience response system, unless you want to clap or throw tomatoes, whichever. How have we done? How have we done in trying to actualize this vision for the society for your benefit? Well, ASCP, of course, is a mission-driven organization, and the mission is to provide excellence in education, certification, and advocacy on the behalf of patients and pathologists and laboratory professionals. But the mission has been extended to this vision of not only providing these things for our members, but extending what our members do to how we impact the entire world of medicine beyond just the pathology and laboratory, our clinician colleagues, and of course our patients. And they often refer to, and we've talked about this, if you go back and look at our, we're proud to say, award-winning journal that's co-produced with both AJCP and Lab Medicine, Critical Values. We've talked about this concept in columns over the years. The Task Force on Transition's critical findings not only reaffirms the mission of pathology, but it calls for us to refocus components of what we do. The top theme, when we went out and asked you, what do you want? What do you need to really feel appropriate about your position in the hierarchy of pathology and laboratory medicine? What do you need to motivate you every day to do better by your patients? And it's a simple answer. We need respect. We need respect. We crave respect. And the thing has stopped. We want respect from our peers. We want respect from our colleagues. We want respect from our patients. And from the public for our members' role in health care. How are we going to get this respect that we so badly crave? How do you gain respect? Number one, the time has come for us always to be at the relevant table. What that means is if we're advocating in Washington for changes in payment, or we're advocating in Washington for the appropriate needs of patient, or we're making sure that the government understands the critical nature of pathology and laboratory medicine. But more importantly, locally at home, we talked about this a little bit this morning. In your hospital, how do you get a seat at that administrator's table so you don't have to worry that you have an adequately staffed laboratory, so you don't have to worry whether you have the equipment you need to do your job to do the best by the patients? You also have to listen to what your healthcare colleagues are saying. You have to understand what they're saying about you, respond to their needs in a more timely and appropriate fashion. And you find new ways to contribute to the public good. And ASCP is there to try and help you through our advocacy efforts, through our communication efforts. We want people to know. And together, with our help, we want you to stand up. In every lab, in every setting of pathology practice, it's like that elephant with the who's, we need to shout out, we are here, and we're here to help you get that message across. That message of how critical we are, how central we are to the practice of medicine on a day-to-day basis. So what did the task force in more granular, concrete terms recommend? We recommended that we should advocate for the public health, that we should develop an international strategy because it's not enough in a wealthy country like the United States or Western nations. There are many places in the world where they need our help much more than health care in well-developed nations. We need to develop even better cutting-edge educational programs based on the best science so that we know the best practices for our day-to-day practice. And to help us do that, we are going to do significant health policy and health science research. To help develop the data, no longer is it going to be just sufficient to have expert opinion. We want data to support everything we say so that when we have a meeting or a hot topic or a seminar, the data that's being presented is supported by, or the recommendations being presented are supported by the very best scientific data. So let's see how we've done. Anybody read the paper? ASCP has been in the papers. One of our public policy agendas has been joining together with patients and other like-minded organizations to oppose the concept of gene patents. Just as you can't patent gold or silver, nor should anybody have the ability to patent your genetic information. And as we were quoted multiple times, the problem with gene patents besides the basic concept that genes shouldn't be patentable whether you agree or not, the basic concept, the problem with the gene patents is they inhibit the best practices in pathology and laboratory medicine. We can't have interlaboratory comparisons. We can't do controls appropriately. We can't allow patients to get second opinions when all laboratory practice is controlled by a single laboratory because of patent protection. So whether you agree with this or not, and some of these items that we're going to discuss, by their very nature, polarizes some aspects of our own memberships. We have to weigh and make decisions. We have to lead by balancing the good versus the potential drawbacks of some of these decisions, and always ask the question in this concept of transformative patient-centered advocacy, what is best for the patient, regardless of what is good or not for our laboratories. Another example where we've had very active advocacy, where we've succeeded in getting the laws and regulations changed, and then the world adapts to the regulatory change. We haven't quite fixed this one yet, but this concept of pod labs, this concept that our clinical colleagues, as they are squeezed externally to maintain their own practice incomes, have decided that we are easy pickings, that the pathology laboratories, the billings for pathology are easy to control, and that they may assume our billing, take credit for our work, and devalue the very nature of the critical diagnostic medicine that we practice. And so we oppose pod labs and will continue to oppose pod labs, despite the fact that, again, some members of the society work in some of these situations, because ultimately the analysis and the data suggest that this is probably not the best thing for some of our patients. The New York Times is my favorite newspaper, national newspaper, being from upstate New York. But even a quality newspaper like the New York Times, sometimes prone to error. The error was the New York Times. Okay? The New York Times got it completely wrong. Okay? And we were quick to point out what they got wrong. They had this banner headline about the problems with pathology. This article really slammed pathology because they said that a pathologist made the wrong diagnosis, and that led to a patient being overtreated for breast cancer. And they picked as their example ductal carcinoma in situ. So in one laboratory, the patient had ductal carcinoma in situ, and in another laboratory, the patient had atypical ductal hyperplasia. But she had already been treated for her ductal carcinoma in situ, probably overtreated as a cancer rather than an in situ process, before that disagreement in diagnosis was made. But I'm here to tell you, and as I said on our website, these are differences of opinion that are not based on hard science. When I moved from Rochester to Cleveland and then to Virginia, ductal carcinoma in situ was different in every place. We know these are issues that we have in histologic diagnosis. The critical issue is for us to educate our clinician colleagues about the ambiguities and uncertainty of certain diagnostic categories, rather than to assert and divide ourselves and say, I'm an expert, therefore I am right, and he or she is obviously wrong, because they disagree across a gray zone that is completely non-reproducible. Once properly educated, I might add, then the clinicians can plan appropriately. In part, some of this miscommunication and misperception is our own fault. We sometimes assert that we are better than we really are. I would recommend that we finally come clean and recognize our limitations so that we can work with our clinicians to appropriately manage patients in settings of diagnostic ambiguity. And that really should have been the message in the New York Times. Addressing the workforce shortage. So here we have a paradox that persists at a time of 10% unemployment. Every laboratory in the country has got jobs, right? Educated laboratory professionals are the most employable segment of our population. And we have this incredible disconnect between the need for laboratory professionals, the availability of suitable laboratory training programs, and the ability to get the right people into the right labs to be employed. As has been shown in study after study, careers in laboratory medicine are among the most attractive. And we have reached out, the ASCP has an ambassador program, and we formulated what we call our comic book for kids in high school and middle school to read about the potential. This has been an incredibly popular program, and a small pool of ASCP ambassadors that routinely reach out to high school students and below have touched more than 3,000 students in just a few years. And I would say we don't need to touch 3,000. We need to expand this program, touch 300,000, drive people into the career that we know can be so rewarding. Because it's been in the news. The best jobs are in pathology and laboratory medicine. Our international strategy, we are the American Society for Clinical Pathology, but like America, we are bigger than ourselves. We have been actively working now for several years to push out the boundaries of quality pathology and laboratory medicine to the areas of the world that have needed it most. We've done this in several ways. The first meeting of our International Commission is occurring today at the Society. We have created a certification structure in a remarkably short time in all of these countries that is collaboratively interacting with the educational systems in these countries to bring forward the standards of ASCP certification, ASCP-I as we call it, which is a certification that in this state is reciprocally recognized with U.S. certification in terms of the quality and standards of people certified under these programs. This is a method of bringing quality pathology and laboratory medicine practice to the world. And we've only been doing this a short time, but we've already had almost 3,000 applications from 54 countries in various specialties. More than 1,500 people have taken our examinations, and the rate of increase in this area of activity is nothing short of spectacular. And it's impacting multiple areas of the world, not just Africa or South America, but the Middle East, Eastern Europe, wherever the need should apply. We've also expanded our global outreach effort. ASCP is proud to be a partner with the Centers for Disease Control in the PEPFAR initiative that brings antiretroviral therapy to HIV-infected individuals around the world. As you all know, you can't do antiretroviral therapy without quite sophisticated laboratory testing and monitoring. ASCP is in those labs training the individuals, maintaining the quality, serving in 16 PEPFAR countries around the world, training in basic hematology, CD4 testing, phlebotomy, strengthening curricula. In the places we've been there longest, we're already helping those countries in partnership with the WHO achieve laboratory accreditation as well as ASCPI certification for the individuals that have gone through ASCP volunteer training. We're all aware of the devastation in Haiti. ASCP had been in Haiti working through PEPFAR before the devastating earthquake. I'm just going to run through some images taken at the time of the earthquake. Now, we didn't rush down, as ASCP was prepared to rush down and help to reestablish laboratory medicines. We were specifically asked by the government of Haiti and the Ministry of Health to wait a few months. But after those few months passed, ASCP returned to Haiti to help reestablish the laboratory infrastructure that we had helped to build. I want to play a brief video clip of some of the elements of that mission.
At the beginning, we thought it was not possible. We even call it a mission impossible. But as we go on and actually putting things down, it's a little bit easier.
As you know, the healthcare system in Haiti was already, before the earthquake, the situation was quite difficult because we are a resource-limited country.
Look at the children. You see the little child right there? Look at what kind of food they're eating. You see what I'm saying? It's really terrible.
As a result of the earthquake, a lot of institutions were damaged. In addition to that, we were faced with complete collapse of the organizational administration of healthcare in general.
If we have an aftershock, you better start praying, because this building was not deemed to be in good shape. And clearly you can see they have much more spaces to do all the testing, and you can see the reduction of the benches compared to just one side and the tent.
The laboratories are extremely important because more than 70% of the diagnosis can only be made accurately only using laboratory data, and it has been recognized that laboratories are critical really in the delivery of quality care.
Oh, yeah.
You can see that anyone can have access to it.
I came as part of a 4-member team with the American Society of Clinical Pathologists, and we are here to do an assessment of the National Public Health Lab and the State University Hospital Lab in Port-au-Prince. We were very inspired by the dedication of people, the staff. Many of them were living in tents under just really extreme physical hardships, and yet they were coming to work every day and trying to do what they could to help the community to provide health care services. It was very inspiring.
This time I have the opportunity to come myself and give my time and collaborate with this project of laboratory management, and also see how people is working and how we can advise them for have a better result in a safety environment.
What we're suggesting is to, in the short term at least, to decrease the amount of the known testing area, to increase the testing spaces, because when it's really busy, people will really bump into each other and you need more space.
One of the major problems we had identified into the laboratory network development was the scarcity of human resources that are well trained to really operate these laboratories. So the help that ASCP has been providing has been extremely important, because it really targets the basis of laboratory operation.
Ladies and gentlemen, the dedication of the staff and the volunteers, some of whom I've met, many of whom I haven't, that have taken their time and gone down to work in these conditions and in some of the roughest conditions on the planet around the world. It's just an amazing thing to be able to facilitate not only that experience for the volunteer, but they're able to basically reestablish health care, or establish health care for the first time in many areas of the world. And again, I don't know of any of the volunteers who went to Haiti or in the audience. If you are, please stand. But again, I think they deserve another round of applause. Okay, well, what about other things from the task force document? What you'll hear most about at this meeting and in many meetings to come is the interface between molecular diagnostics, how molecular and other technologies that are on the cutting edge will lead for the first time to truly personalized medicine. The ability for us to marry laboratory testing in a way that will direct not only therapy appropriate for populations, but therapy appropriate for individuals. And ASCP is dedicated resources, time, and effort to bringing forward and helping to make that vision a reality that's coming much sooner than later. And to help us do that, as was in the last issue of Critical Values, and on which I think that the incoming president, Dr. John Tomaszewski, will talk about, is ASCP's dedication to establish something new for the organization, something we feel is absolutely critical to help drive this vision of patient-centered advocacy, an Institute for Health Policy and Health Services Research that will generate data that will inform the decisions, that will inform the education programs in a way that truly in a 360 manner meets the needs of all of us as we try to move forward and realize this vision of personalized medicine. So you'll hear a little bit about it, but this is a long-term project and commitment. And more about the future. In every one of your bags is this report that we commissioned to get not only input from within pathology, but from external sources, experts, leaders at large medical centers, the insurance industry, the government, et cetera. This report is in everybody's bag. I encourage you to read it. Friday tomorrow at 5:15, we'll have a plenary, I believe, in this room. Forgive me if I got it wrong, but I think in this room there'll be a plenary session where we'll discuss the ramifications of this report with an outstanding panel of experts to help you better understand what's lying ahead for us in the future. And speaking of the future, part of the job of ASCP is to continue to move forward. On Saturday at the annual business meeting, Dr. John Tomaszewski will be inducted as our new president. He will share his vision of how the processes we've started over the last 2 or 3 years have stimulated the beginning of this trajectory, which we're going to take the society and hopefully take all of you on this journey to realize a new vision as how we practice in pathology and laboratory medicine. And of course, we searched for over a year for the absolute best possible person to lead the staff, which partners with the leadership and the volunteers to realize or actualize this mission. That leader was Dr. Blair Holliday, who is going to help us on this journey. So Blair and John, we look forward to your leadership. We look forward to hearing about your vision. So I started by saying we want your opinion, and I will stand back a little bit, but I ask you, how have we done? How are we doing? We're just beginning, but how are we done in terms of advancing by caring, in terms of trying to advance the society by truly caring for our patients, while also advocating for our society, not just ASCP, but all of society. I would have to say that within this room, we're much more together as a society than the election would suggest. It's going to occur next week. This concept of patient-centric societal advocacy, I believe, is a transforming concept. It's one which we all can take to heart. It's one where you can use the ASCP letter to help you remember, the initials of the society to help you remember what we're talking about. And that's really what we as a society, we as a group of dedicated pathology and laboratory professionals think must happen for our profession to thrive in the coming years. I want to end by saying thank you. Thank you to my many mentors, to the awardees, to my many colleagues throughout my career that have facilitated the ultimate privilege of being your president. And of course, I have to thank Paula, who's sitting right here, for tolerating all the time I spent away from our family working on your behalf. I believe she deserves a special round of applause. It's time for the voiceover. Thank you very much.